In this video, we'll guide you through the next exercise, engaging and disengaging a Smartwire in lower anterior teeth with crowding. We'll be working with the lower anterior crowding model labeled 4-L. If needed, pause this video to retrieve an engager, lingual Weingart, Smartwire plier, the lower training models, and the flat Smartwire labeled 4-L. Note that the tag with the 4-L label goes on the patient's right side, and both lower central incisors have holes in the core of their lockets, which helps identify an upper versus lower Smartwire. Now let's begin the exercise. Using the Weingart plier, lightly grasp the neck of the lower left central incisor locket and engage it. Next, engage lower left 2, lower left 3, and lower right 1 using the same technique we discussed in the earlier video. Seat the locket with the Weingart, position the engager with proper angulation, and push on the bend of the engager with your non-dominant hand. Next, engage lower right 2 and 3. When engaging the lower right 2, make sure that the lower right 3 locket stays more lingual to the bracket, as demonstrated here. You may need to push the lower right 3 locket lingually while engaging lower right 2. Then, when engaging lower right 3, it requires a little more manipulation to fully seat it, as you can see here. But overall, it still follows the exact same technique as we've been discussing. Before disengaging the Smartwire, let's take a closer look at the lower right 2-3 region. Let's first look at a few images of the lower model with the engaged Smartwire. In the lower right 2-3 region, notice how the interproximal loop fully overlaps on itself. Because of the position of the lower right 2 bracket relative to the lower right 3 bracket, the lower right 2 bracket must be engaged before the lower right 3 bracket to orient the interproximal loop overlap correctly as shown in the images on the left. If the lower right 3 bracket was engaged first like shown on the right, the interproximal loop would overlap in a way that blocks the lower right 2 locket from engaging in its bracket. When you encounter these crowded situations, it helps to engage the more labially positioned bracket, like the distal of lower right 2 in this situation. If you're unsure about the correct order when working on a patient, try engaging the lockets. If you find that the interproximal loop overlap prevents an adjacent bracket from engaging, don't force it since that will break the wire. Instead, simply disengage and change the order, engaging the bracket that could not be engaged first. Next, disengage the Smartwire with the engager with the technique described in previous videos. For each anterior tooth, position the straight end right against the tooth, make sure to have a proper fulcrum, push down, and roll out. Re-engage the Smartwire again to practice disengaging with the Smartwire plier. With the Smartwire plier, for each bracket position, the tips behind the neck of the locket and gingival tab, gently squeeze and roll lingually to disengage. For better control, use your non-dominant hand to stabilize the position of the Smartwire plier when positioning the tips like demonstrated here. This completes the exercise for Model 4, engaging and disengaging a lower anterior crowding model. We recommend practicing this exercise until you feel comfortable working on crowded lower anterior teeth. In the next video, we'll work on the 5th model to learn how to bond a mini tab.